I'm Joe Novak. I'm one of the family medicine doctors with North Memorial Health. I thought for a while that I was going to be an engineer. Went to college and studied physics for that. And it was sort of that was a gradual transition for me. It was kind of realizing that I would have missed that personal connection with people that you get in medicine. So that was one of the things that drew me to family medicine rather than some other areas of medicine, is that you're seeing people in a long-term setting. So you may see them in a really hard spot, but you're also going to see them when they're doing really well. So you get a sense of connection with people kind of across all ages, all states of health, and you get to be there and be a resource for them, which is really fulfilling. I do have a couple areas of interest, mainly addiction medicine and then gender-affirming care as well. For a lot of this is starting from a place of getting to know the person who's sitting in front of you and what their story is. I think the first visits that I have with somebody who is coming in for gender-affirming care they're long visits, and we talk about medicine for about that much of it. Treating people who are dealing with addiction in their life, I find it's a group of people who really want help, need help, and are really willing to meet you where you're at as a provider. I hope that that's creating a safe space, because I think it's really important, again, knowing the context of how somebody got where they are and got into the room with you. I can prescribe medicines all day long, but if somebody has other things going on, they either don't want to take medicines or they don't really understand why we're prescribing medicines, then what I'm doing is kind of useless. If somebody's really engaged, to me that means we're going to have a good partnership going forward, and we're going to be able to optimize their health as much as possible.